At Albany Medical Center, we continuously seek ways to enhance and evolve care delivery, to strengthen our commitment to patient safety and quality, and to address barriers to care, often with partners who are just as dedicated to our community. This partnership embodies Albany Medical Center's and Maria College's shared commitment to our communities and to the betterment of healthcare for all. As I always resonate, access to healthcare is a basic human right. Let me repeat that. It is a basic human right and should never be deemed a privilege. Of course, this partnership would not be possible without the support and leadership of my near and dear friend, Dr. Lynn Ortali, the president of Maria College.
I believe that innovative ideas come from what I call collective genius. I have some expertise, you have some expertise, you have some expertise. But if we're willing to bring our expertise together for the good of others, that's when the magic happens. And that really is how the clinic was born. Access is at the center, and making sure that patient care is first and foremost. We had the vision and the expertise. Guess what we didn't have? Money. But we really needed the funding. And this initiative was made possible through significant philanthropic investments, including $75,000 from the Innovation Partnership, which is a collaboration between Albany County and MVP Healthcare. An additional $75,000 from Albany County.
The mission of the Transitional Care Clinic is to improve health outcomes by reducing avoidable emergency department visits, preventing hospital readmissions, and ensuring enhanced access and coordinated support for patients with complex medical and social needs. We foster education and training of the next generations of residents, medical students, advanced practice providers, and nursing students, teaching all group of learners the impact of social determinants of health, providing experience in best practices in transitional and ambulatory care, and invaluable direct patient care. This is what transitional care medicine looks like when it works. Timely follow-up, team-based care, education, and accountability, keeping patients healthier and out of the emergency department and hospital.
Maria College nursing students will play an active and meaningful role in the clinic. Under the supervision of licensed professionals and faculty, our students will engage directly in patient care, gaining a unique hands-on clinical experience. This experience will stay with our students throughout their careers and ultimately strengthen the healthcare workforce of the Capital Region. This clinic is more than a training site. It is an investment in our community, our students, and the future of healthcare. It is now my pleasure to thank and introduce County Executive Dan McCoy, whose leadership and dedication to improving health outcomes in Albany County has been instrumental in bringing this project forward.
We had to reimagine and figure it out. That's what partnerships are about, figuring it out. All right, sometimes it's like in government, you start down this one path, and the next thing you know, how do you end up over here? Because this wasn't gonna work, and you have to adjust and figure it out. It's easy to point fingers, it's easy to blame things, and you look at COVID, it burnt out a lot of nurses, it burned out a lot of hospitals. You've seen record numbers of retirements and the shortages that we're having with the nursing. And it's trying to figure it out, and it's easy to point fingers and say, well, the ERs are always crowded and this and that, and we can have hearings as politicians, but we're not helping you solve the solution except pointing the finger saying, hey, you're doing this wrong, look at your ERs, figure it out. And to have a collaboration like this and a foundation for a nursing school to get live experience, and to deal with patients and see a different outcome of sitting there connecting the dots for them and the services they need and the care they need when they come out. You can't get enough education to get live experience to work side by side with a hospital like this, to work with nursing staff and doctors and everyone else. What I say to this partnership, it's a foundation to build on, to continue the partnership, and to continue to figure out how we can make these ERs work more efficiently, but also get an experience and education. And the best learning in life sometimes is when you don't realize you're being taught.
This clinic represents the kind of forward-thinking, collaborative approach that is truly needed to move the needle on community health. And I think you heard that, throughout all of the comments made today. I do want to talk about collaboration for a second, because this was such a great example of what can be done when we work together. But I think it's something that we need to collectively continue to be better at. We need to break down our competitive walls and our different positions at times and show up together to really make meaningful change. Change that supports better health for the residents of this region. And I want to echo everything you heard from County Executive McCoy to all of you. Be bold, be brave, speak your mind, help your patients in ways that maybe you didn't learn in nursing school, but is the right way to help them. Always speak up. Lastly, I want to thank County Executive McCoy for his leadership, his vision for Albany County, his work with MVP and Innovation Fund to build partnerships like this one that really encourage innovation and truly have a positive impact on our community. Thank you.